Can you use retinol creams when you're pregnant or breastfeeding? Well, if you're a new parent and you're missing your skincare routine, here is the truth about using retinol. So the retinoids, retinol creams get a bad rep in pregnancy appropriately. We should not be using any of this family of medications either orally or as creams because they're vitamin A derivatives, and vitamin A derivatives are potentially harmful to a developing fetus. They are teratogenic. So you absolutely should not be using any of these creams when you're trying to conceive or when you're pregnant. That's because of those risks. It could potentially cross the placenta to the developing baby and affect them. But what about breastfeeding? Well, here's the good news. Topical retinol creams, so retinoids, retinols, retinols, are generally safe to use when you're breastfeeding. It's shown in the LactMed database here, and they show that there's no evidence of any harmful effect if you're applying these creams to your skin when you're breastfeeding. Why? Because your skin doesn't absorb enough of these retinols to pass them into your milk in meaningful amounts. We're also not sure if a baby that got retinol would have the same effect as a fetus that's developing. It's unlikely to cause them the same amount of harm. But if you're just applying them to your skin, it's unlikely to be absorbed enough that it even gets into your milk enough that your baby's going to receive a high dose of retinol. The only caution, I would say, avoid applying it directly to your nipples or to your chest area because we don't want them to be sucking directly on that cream. So avoid anywhere that your baby's skin could come into contact. But if your skin is feeling dull and tired, retinol creams are actually really good for anti-aging properties. So your retinol serum is not cancelled when you're breastfeeding. Let me know if you'd heard this misconception before and tag a friend who needs to know this.